Hello dear students, welcome back to my YouTube channel. I am Dr. Dildar Hashmi and today we will discuss the very important topic, that is postpartum hemorrhage, right? In short, it is known as PPH, right? This is the very important topic that can be asked in your university exam as a long question. So for better understanding, please watch the complete video, right? So we will discuss postpartum hemorrhage, that is PPH, in different sections. First of all, we will discuss the definition of PPH. Then we will discuss about the types of PPH. What is the pathology? What are the risk factors of postpartum hemorrhage, that is for the risk factor of PPH. And then we will discuss about the signs and symptoms so that we can know that this is the case of PPH. And finally we will discuss about the management of PPH. Management is very important here, that if you diagnose that this is the case of PPH, then what are the management or initial step that can be taken to save the life of mother, right? So let's start with the definition. What is PPH? It refers to the any amount of bleeding from or into the genital tract following the birth of the baby, right? So after the birth or the delivery of the baby, if there is any amount of blood loss, why we are writing here after delivery, that means during the delivery there is normal blood loss, but after the delivery there should not be any blood loss, right? So what is the amount of blood loss in case of normal delivery? In case of normal delivery, there is up to 500 ml of blood loss, right? In case of LSCS, the blood loss can be up to 1000 ml, that is about 1 liter, okay? This is the normal blood loss that can be there in case of normal delivery and LSCS. So what is PPH? If the blood loss that is more than 500 ml in case of normal delivery, and if it is more than 1 liter in case of LSCS, right? This is known as postpartum hemorrhage, right? There is one other definition for the PPH, that is according to ACOH. It refers to that the decrease of hematocrit by 10% and or there is need of blood transfusion. There is need of blood transfusion following birth. Following the birth of the baby. This is known as PPH, right? The first thing that we need to remember is blood loss more than 500 ml in case of normal delivery, and in case of LSCS, blood loss more than 1 liter, or according to ACOH, decrease in hematocrit by 10%, or there is need of blood transfusion. This is known as PPH, okay? Let's discuss the types of PPH. What are the types of PPH? There are mainly two types of PPH. The first one is primary PPH. Okay, the second one is secondary PPH. प्राइमरी PPH क्या होता है? अगर ब्लीडिंग स्टार्ट होती है विद इन 24 आवर्स, अगर ब्लीडिंग स्टार्ट होगी विद इन 24 आवर्स, इट इज नोन एज प्राइमरी PPH. ओके, आफ्टर द डिलीवरी, राइट, दिस इज आफ्टर द डिलीवरी. अगर 24 घंटे के बाद, आफ्टर 24 आवर्स of delivery, if there is any bleeding after 24 hours of the delivery, this is known as secondary PPH, and this can be up to 12 weeks. 24 घंटे के बाद 12 वीक से पहले तक अगर कोई भी ब्लीडिंग होती है, दिस इज नॉन एज सेकेंडरी PPH. ओके, causes. What are the causes of PPH? So to remember the causes, we need to remember actually the 4 T's. 4 T's. That means the first cause is, the first T is tone of uterus. Tone of uterus or uterine atonicity. We will discuss all that in detail also. The second T is if there is any trauma to the uterus. If there is any trauma to the uterus, that can lead to the PPH. Okay, the third T that stands any tissue left inside the uterus, that can also lead to the PPH, right? The fourth T that stands for thrombin deficiency. राइट, अगर यूट्राइन की टोन में कोई एबनॉर्मलिटी आएगा या कोई ट्रॉमा होगा या कोई टिश्यू यूटरस में लेफ्ट रह जाएगा या थ्रोम्बिन की डिफिशिएंसी हो जाएगी, तो क्लोटिंग मैकेनिज्म इफेक्ट होगी और उससे क्या होगा, आपका PPH होगा. राइट, सबसे पहले आपको यूट्राइन टोन के बारे में समझाते हैं और एटोनिसिटी के बारे में समझाते हैं. ओके, actually what happens after birth, or after delivery, the uterus contracts. Okay, uterus contracts, that leads to the compression of the vessels. यूटरस में जो ब्लड सप्लाई होती है वो कंप्रेस होती है. क्यों? जब यूटेरस कॉन्ट्रैक्ट होती है, मतलब डिलीवरी के बाद में नॉर्मली यूटेरस अपने ओरिजिनल पोजीशन में आने की कोशिश करता है. दैट मीन्स द यूटेरस कॉन्ट्रैक्ट्स, दैट लीड्स टू द कंप्रेशन ऑफ द ब्लड वेसल्स. राइट, इफ देयर वुड बी कंप्रेशन इन द ब्लड वेसल्स, दैट मीन्स देयर वुड बी नो ब्लीडिंग. It is known as living ligature. It is known as living ligature pinard. Okay? So after delivery, normally the uterus contracts, and due to the compression of the vessels, there would be no bleeding. Right, if there would be any abnormality in the process, if there would be any abnormality in this process, right, the process that I have discussed here, if there would be any abnormality, that means the living ligature would not act properly, or the compression of the vessels would not be proper, that means there would be continuous bleeding, and it is known as PPH. Okay, so this is the pathology. And if there would be any trauma to the uterus, that will also act, that will also lead to the bleeding. And if there would be any tissue, maybe the placental tissue that is left inside the uterus, that can lead to bleeding after 24 hours, may be the cause of secondary PPH. Okay, and if there would be any thrombin deficiency, the clotting mechanism would be affected and there would be continuous bleeding. Okay, let's discuss the causes of PPH in more detail. Okay, the causes of PPH I have mentioned here for the primary PPH and secondary PPH differently. So the causes for primary PPH is atonic uterus, right? If there is any trauma that I have discussed, right, retained product of the conception, right, it may be the placenta, if uterine rupture is there, uterine inversion is there, and if there would be any blood coagulopathy like thrombin deficiency. Okay, that can lead to the cause of primary PPH. Okay, now secondary PPH, actually secondary PPH, that will start after 24 hours, right, that may be up to 12 weeks, right. So the causes of secondary PPH is retained bits of cotyledon or membranes. If there would be any infection, cervico-vaginal laceration, endometriosis, right, secondary hemorrhage from the cesarean section, and some other causes are mentioned here like fibroid polyp, inversion of the uterus, carcinoma of the cervix, placental polyps. These all can lead to the secondary PPH. Okay, I am not going to discuss all these again, I have mentioned here already. Okay, now what are the risk factors of PPH, right? That means the mother, we are talking about the mother that can act as the risk factor, or that may cause PPH after the delivery, right. If there would be prolonged third stage of labor, थर्ड स्टेज अगर काफ़ी लंबी चल रही है तो PPH हो सकता है, ब्लीडिंग हो सकती है डिलीवरी के बाद भी. अगर मल्टीपल प्रेगनेंसी का केस है, मल्टीपल डिलीवरी का केस है, तो दैट कैन लीड टू द PPH. एपिसियोटोमी मतलब हमने इंसीजन दिया था, क्या दिया था, इंसीजन दिया था, क्यों, फॉर गेटिंग मोर डायलेशन, फॉर गेटिंग cervix dilation, more dilation. Okay, that can also lead to the PPH. If there is fetal macrosomia, history of postpartum hemorrhage, मतलब पहले भी PPH हुआ है ना. There is placenta previa, there is placental abruption. We will discuss all this in detail in our next topic also. Pregnancy induced hypertension, if there is the case of hypertension, that can lead to the PPH. And if there is any infection, that can also lead to the PPH. Okay, what are the symptoms, how we can know that this is the case of PPH? So there would be massive blood loss, passing of large clots, dizziness, lightheadedness or fatigue, decreased blood pressure, increased heart rate, right, swelling and pain in tissues in the vaginal and पेरिनियल एरिया. ओके, दीज आर द सिम्टम्स, राइट. आपको लगेगा कि काफ़ी ज़्यादा ब्लड लॉस हो रहा है डिलीवरी के बाद, या क्लोट्स आ रहे हैं बहुत ज़्यादा, या चक्कर आ रहे हैं, या फैटिग, या फिर ब्लड प्रेशर डिक्रीज हो रही है, या हार्ट बीट इंक्रीज हो रही है, ऑल दीज आर द सिम्टम्स ऑफ PPH. ओके, all these are the symptoms of PPH. What is the next thing that we are going to discuss here? We are going to discuss the management part. Okay, so the management is very important here. So before discussing the management, let's recall the whole topic of PPH. That is PPH, it is the blood loss that is more than 500 ml in case of normal delivery, or in case of LSCL it is if it is more than 1 liter, or if the hematocrit value decreased by 10%, or if there is any need of blood transfusion following the birth. All these are known as the case of PPH, right? Then we had discussed about the types. In types we have primary PPH and secondary PPH, right? We have discussed primary and secondary. Primary is that is within the 24 hours after the delivery, and secondary is after 24 hours of the delivery, that can be up to 12 weeks of the delivery, right? Then we had discussed about the 4 T's, and the 4 T's that we have discussed here is the tone of uterus, uterine atonicity, right? After delivery the uterus contracts, that acts as the living ligature pinard that compress the vessels, and the bleeding stops, right? If there is any abnormality in this process, the bleeding will continue and is known as PPH, right? Any trauma, any tissue left inside the uterus, and if there is any thrombin deficiency. Okay, then we had discussed about the risk factor. What are the risk factors? You can remember from here, right? If there is prolonged third stage of labor, if it is the case of multiple delivery, if there is episiotomy given during the delivery, fetal macrosomia, placenta previa, placenta abruption, and if there is pregnancy induced hypertension or any infection, all these are the risk factors. How we come to know that this is the case of PPH, right? If there would be any massive blood loss, passing of the large clots, dizziness, fatigue, decreased blood pressure, increased heart rate, and if there would be any swelling and pain in the tissue in the vaginal and the perineal area, all these are the symptoms, right? So we have come to know about all these things. Now let's talk about the management part. Okay, how do we manage the case of PPH? Okay, this is very important. The first thing